Hello, my name is Mary and I'm a registered nurse here at Providence Holy Cross Medical Center. By now, you've already seen how our entire staff works together with you and your advocate to ensure you receive excellent family-centered care during your hospitalization. It is equally important to us that the treatment you begin here continues to benefit you after you leave. In fact, all the health professionals and specialists involved in your care have been planning since the beginning to ensure a safe and smooth transition at the end of your stay. I'm going to talk to you about how we structured the discharge process to support you and your healthcare team outside the hospital.
Yes, the nurse will go ahead and do that.
The discharge process is exactly that, a process. It may take a few hours from the time your primary doctor initiates your discharge until the time that your entire wellness team has fully prepared you to leave the hospital. In addition to your primary doctor, your consulting physicians must also review and sign discharge orders. Your primary nurse, discharge planner, and case manager will coordinate the discharge process and make sure you have everything you need. You continue to be the most important member of your healthcare team, so be sure that you and your advocate stay informed about your rights and responsibilities associated with discharge. When you have questions about the discharge process, please ask your primary nurse and they will make sure you get the answers you need. Your nurse will also be updating your whiteboard with discharge information and instructions. You may have concerns about what happens after you leave the hospital. Providence Holy Cross has a comprehensive range of services to support you and your family during this transition period. For example, it is very likely you have experienced a significant life change during your hospitalization, such as starting a diabetic diet or requiring medical assistance in your home. Your case manager will assist you in navigating your options. However, it is important to keep in mind that the final decisions about the next steps in your care will be made by you and your doctor. Also, our financial counselors are available to help you understand the costs associated with your hospitalization and review your Medicare or private insurance coverage. You are going to be receiving a lot of important papers and instructions during the discharge process. Understanding the contents of these items is extremely important to your well-being. So I'm going to explain some of the materials you can expect. I recommend keeping all of these papers together with your orientation packet. This way, you can have all the important information in one place when you leave. Your case manager will review two of these documents with you. The IM, or Important Message from Medicare about your rights, and the Acknowledgement of Discharge Arrangements. These two papers explain your rights during the discharge process and during the selection of certain medical services and equipment for when you leave the hospital. The next important set of papers is your discharge instructions, which include 4 types of information: treatments and instructions from your doctor, phone numbers for follow-up appointments, information on community resources, and your full medication list. The treatments and instructions section specifies what your doctor has prescribed in terms of special dietary considerations, physical activity, and other treatments. You can also read about what you should do if you experience certain symptoms related to your condition. The follow-up appointments section lists names and phone numbers of the physicians that you will need to see within 1 or 2 weeks of your discharge. You should make these appointments as soon as possible. The community resource section contains any external resources you can call after leaving the hospital, such as a free service to help you quit smoking. The medication section contains all medications you will start or continue at home. This new medication list has been set by the doctor overseeing your care in the hospital, and it replaces any previous medication list you may have been using prior to or during your hospitalization. Whether your next medical appointment will be at your doctor's office, at your own home, or in another facility, your medical paperwork will be sent to the appropriate health provider. Of course, you should keep your own copies with you as well. Finally, you will also be receiving care notes and other patient education materials to help you better understand and manage specific conditions, such as high blood pressure or congestive heart failure. After you receive all the necessary information and our staff has helped you arrange the next steps in your care, you are ready to leave the hospital. Your nursing assistant will help you gather your belongings and get dressed. Double check your room to be sure you haven't left anything in the drawers, cabinet, or bathroom. Also, be sure your advocate or family member brings you some of your own clothing to change into. A staff member will escort you down to the discharge pickup area. In order for your hospital room to be available for another patient, you or your advocate must arrange for you to be picked up at the pre-arranged time. And if you are having any medical equipment delivered to the hospital, you need to be sure the vehicle your family brings is large enough to take everything with you. The last thing I want to talk to you about is what happens after you leave the hospital. A representative from our Patient Relations Department will be calling you during the week following your discharge to make sure that everything is okay. They will confirm that you have made follow-up appointments with your physicians and specialists. The patient relations representative will also ask if you are following the treatment plan, diet, and physical activity plan prescribed by your doctor. After leaving the hospital, if you have any other questions about the next steps in your medical care, including questions about your new medication list, please contact your primary care doctor. Whether you are leaving Providence Holy Cross today or in the next few days, I hope this video has helped give you a better idea of what to expect during the discharge process. Don't worry if you still have questions or concerns, because the discharge planner will take time to review the process with you in more detail. Thanks for your time and best wishes for a speedy recovery.
As the Chief Executive of Providence Holy Cross, I want to thank you for trusting us with your care. Our commitment to your health continues now that we enter what we call the discharge process. Working together with our dedicated staff, you will begin to think about and plan this next phase in your care. I hope you will make use of all the excellent resources and services we have available for you and your family. As part of our mission to continuously strive to improve our quality of care to you and to future patients, you may be receiving a patient survey. Because your reflections and comments on your healthcare experience are invaluable to us and to future patients of Holy Cross, I ask that you take the time to fill out this survey and send it back. On behalf of our entire staff, thank you for helping us to ensure that we continue to provide the very best care and service to our entire community. Be well.